Welcome to Science Force, where science comes alive. Right, let's jump straight in. A very warm welcome to you all to this explainer. Today we are unmasking a highly contagious respiratory villain that has quite literally been haunting humanity for centuries. I am absolutely thrilled to guide you through this because we are going to break down something that is both medically fascinating and incredibly relevant to our daily lives. We are looking at pertussis, an infection that brings with it a cough so relentless it feels like it might never actually end. Now here is a question for you. Why on earth is it called the 100-day cough? I mean, think about it. In our modern age of advanced medicine, how can a single microscopic bacterial infection cause symptoms that linger for more than 3 months? No way, right? Well, whether you're a medical student gearing up for exams or just someone wanting to protect your family, this is the exact burning question we are going to answer today. The roadmap. Okay, let's dive into this roadmap. We'll systematically decode this disease. The bug and its toxins. Pathogenesis. 3 clinical stages. Diagnosis and complications. Treatment and prevention. Pertussis memory trick to wrap this all up. 1. The bug and its toxins. Alright, let's kick things off with Section 1, the bug and its toxins. It is time to officially meet the microscopic culprit behind all this chaos. Meet our primary suspect, Bordetella pertussis. Now for the med students out there, you know it's a gram-negative coccobacillus. But for everyone else, just think of gram-negative as a very specific tough outer armor the bacteria wears, and coccobacillus simply means it's shaped like a tiny stubby little rod. It is strictly aerobic, meaning it absolutely needs oxygen to survive, which is exactly why it loves hanging out in our airways. It doesn't form spores and it's non-motile, so it can't swim. But here's the crucial bit. Human beings are its only natural host. It exclusively targets us. Now what's really interesting about this bug is that it doesn't just sit there quietly. Oh no, it secretes a highly potent cocktail of toxins. Pertussis toxin essentially ramps up your mucus production and sends the immune system into total frenzy. Filamentous hemagglutinin. Think of FHA as these sticky little microscopic hooks that let the bacteria latch tightly to our airway cells for dear life. Tracheal cytotoxin. This is the devastating weapon that literally destroys the sweeping, hair-like cilia in our windpipe. Adenylate cyclase toxin. This acts like a biochemical smoke bomb, blinding and weakening our immune cells so the bug can easily evade capture. 2. Pathogenesis. With those weapons understood, we transition smoothly into Section 2, the pathogenesis. Let's see how this bug actually orchestrates its structural attack once it gets inside. Let us walk through this step by step, almost like an investigative case file. After an incubation period of anywhere between 5 to 21 days, usually about a week or 2, the attack sequence officially begins. Entry. This usually happens via microscopic droplets from someone's sneeze or cough. Attachment, where those sticky FHA hooks grab onto your respiratory tract lining for dear life. Toxin factory. The bacteria essentially set up a toxic factory, severely damaging the local tissues. Impaired clearance. Because those sweeping hair-like cilia have been destroyed by the tracheal toxin, all that massive mucus just cannot be cleared away. Persistent cough. This trapped, highly irritating mucus inevitably triggers that violent, persistent cough as the body desperately tries to clear out its airways. And that brings us to Section 3, the 3 clinical stages. Knowing the timeline of this disease is absolutely critical for catching it early. Catarrhal stage 1 to 2 weeks. During this time, it just mimics a common cold. You know, runny nose, mild fever, watery eyes. You see, this is precisely why it spreads like wildfire. People assume they just have a minor sniffle, yet they are highly contagious. Paroxysmal stage 2 to 6 weeks. This is the classic whooping cough phase, repeated violent coughing attacks, sometimes vomiting from sheer exertion and just absolute exhaustion. Convalescent stage, weeks to months. The body slowly, painstakingly tries to heal. Now, the presentation of this disease is vastly different depending on your age. For adults and older children, you get that classic, frankly terrifying whoop sound. After a violent coughing fit, the lungs are basically completely empty, so when they gasp for air through a swollen, inflamed airway, it creates that sharp whoop. But here's the frightening part. Infants often don't whoop at all. They simply lack the muscle strength. Instead, they suffer from apnea, meaning they literally just stop breathing, and cyanosis, which is a dangerous bluish discoloration of the skin because they're being starved of oxygen. This is a very silent, extreme risk for our babies. 4. Diagnosis and complications. Let's move forward to Section 4, Diagnosis and Complications. How do we actually spot this in the clinic, and what is the physical toll it takes on the body? When it comes to diagnosing pertussis, we have a few key tools. Nasopharyngeal swab, taken right from deep inside the nose. Culture. Actually growing the bacteria in a culture is considered the gold standard. It's highly specific, but honestly, it takes several days. PCR. That is exactly why PCR is the most commonly used test today. It's rapid, it's highly sensitive, and it detects the bacterial DNA in just hours. Blood tests might also show lymphocytosis. For the med students, you'll know this is a massive spike in white blood cells caused by that pertussis toxin. Sadly, the complications of this infection can be truly devastating. Pneumonia is by far the most common serious complication. But get this, the sheer force of these coughing fits can literally cause rib fractures, hernias, and even broken blood vessels in the eyes. Neurologically, the severe lack of oxygen during coughing spells can lead to seizures and encephalopathy, which is severe brain damage. And I have to stress this point again, it is the youngest patients who face the absolute highest risk of fatal respiratory failure. It's quite a heavy reality, isn't it? But thankfully, we aren't defenseless. Let us shift to Section 5, Treatment and Prevention, to look at our medical counterattack. So the crucial point here is understanding our line of attack. We generally use macrolide antibiotics like azithromycin or clarithromycin. Now, if you give these early enough, they do wipe out the bacteria and stop the patient from being contagious. However, and this is a massive however, the cough will most likely still persist. Why? Well, because those toxins have already wreaked total havoc on the airway cilia. The structural damage is already done, and it just needs time to heal. Therefore, supportive care is absolutely vital. We're talking hydration, humidified air, and sometimes even oxygen therapy just to help the patient actually survive those 100 days of recovery. But of course, prevention is always better than cure, right? And vaccination is our absolute best shield against this bug. DTaP vaccine, given to young children to build that initial immunity. Tdap vaccine serves as the booster for adolescents and adults. Pregnancy booster. Most importantly, pregnant women are highly encouraged to get the Tdap booster during every single pregnancy. By doing this, the mother creates powerful antibodies that transfer directly across the placenta. It beautifully protects the newborn during those incredibly vulnerable first few months of life, right before they're old enough to get their own shots. 6. Pertussis memory trick. We have covered some immense ground today. Let's head into our final section, Section 6, for a fantastic summary tool to help lock all this in. And this brilliantly illustrates everything we've unpacked today. Let's read this colorful pertussis acronym out together. P is for paroxysmal cough. E is for extremely contagious. R is for respiratory infection. T is for toxin-producing bacterium. U is for upper airway colonization. S is for severe coughing fits. S is for small infants vulnerable. I is for immunization prevents disease. S is for supportive care helps recovery. Honestly, you might want to take a quick screenshot of this. It is an absolutely fantastic study payoff and a great recap. Conclusion. So we've successfully unmasked the bug, the toxins, and the grueling timeline of this exhausting disease. But I want to leave you with this final, rather urgent thought. Even with vaccines, because our immunity naturally wanes over time, the 100-day cough is still actively circulating in our communities today. So I have to ask you, are you up to date on your booster? Remember, protecting yourself ultimately means protecting the most vulnerable babies around you. Thank you so much for joining me today, for learning and for taking charge of your health. Stay curious, stay healthy, and I will see you in the next explainer.
Thank you for watching Science Force.